Hi, I'm Dr. Ed Jacobs, the originator of impact therapy, and this is Dr. Tori Stone. And on the set of handouts that you can find on our webpage, impacttherapy.com, and when we go do workshops, we talk about common mistakes of counselors, and we're going to just briefly go over those because as an impact therapist, impact therapy is an active, creative, multisensory, theory-driven approach to counseling. So we're going to talk about what we think are some of the common mistakes of counseling. Reflects more than necessary. A lot of programs teach reflection as almost the main technique. And I think that's a common mistake if you reflect more than necessary.
Reflection is a tool. It is one of many tools that can be used. It can be a powerful tool, but if overused, it can certainly impact the session.
And the idea of listening to too many stories, I imagine as a school counselor, because you only have 20 minutes when you do a session.
Right. And kids will tell, and adults will as well, if they'll listen to what you let them talk about. So listening to stories that are unnecessary to further the aim of the counseling gets in the way of being productive in counseling.
Rarely interrupts the client. It's important for counselors to know that it is okay to interrupt. And sadly, we see and hear of a lot of people being taught never to interrupt, but the goal and the name of the approach, impact therapy, the goal of counseling in our mind is to try to have impact, to try to make a difference. And if you don't interrupt, then you end up listening to stories.
Absolutely. And this is probably a technique you need practice to use it, and you need some savvy to use it. But if you can masterfully get skilled at using it, it's such a powerful technique to be able to stop a client and say, I'm going to stop you. Not because I'm disrespecting you, but because I want to get to our goal, which is making you feel helped about whatever issue we're talking about.
Next one, does not focus the session. A lot of counseling is vague and it jumps around and it goes from one point to the next to the next. And really what we advocate, in the impact therapy book, I talk about RCFF, rapport, contract, then focus, then funnel. And focusing the session is real important. And I think a lot of students don't do that because all they're doing is verbal following.
And if you have a clear contract with the client, it's much easier to focus. We've agreed that we're going to work on this issue, so I'm going to focus you in on this issue because we've agreed that that will help you most.
A lot of counselors wait too long to focus and funnel.
I see that with my grad students a lot.
Yeah.
It's a 25-minute tape. At minute 20, they're like, well, here's where I got in the focus. Well, you've wasted a lot of time that realistically, in a therapeutic setting or in a school setting, you don't have 20 minutes to waste. So we want to get to helping as quickly as possible.
Yeah, does not use theory, uses the hope method. If you're not theory-driven, you cannot really be a very good counselor. It's impossible. And I say that, many people would say they follow Carl Rogers, and most of that is Carl Rogers' techniques, not his theory. But we think you should be theory-driven, have some approach in your mind, such as reality therapy or Adlerian or rational motive behavior therapy or cognitive behavioral therapy. Those are theories that tell why people do what they do. And we find that many people made an A in their theory class, but they're not really theory-driven. They don't listen with a theoretical ear.
And that piece of listening with a theoretical ear, when I hear problems, I'm framing them through the theoretical constructs that I understand. Ed taught me to do that. So that even if a client isn't saying, I should be better at blah, I hear the shoulds that are coming in there. That takes training and practice in cognitive counseling.
The next mistake, makes counseling boring, rarely uses creative techniques. If counseling is boring, I don't think the client learns. And if you're bored, I think you burn out. So we encourage, and impact therapy is a creative approach to counseling. does not pay attention to the clients and his or her voice and face. We did another YouTube clip on voice, face, and pace. The voice and the face, looking at your client's face, how you use your face, and when you watch even the other video clips, if you watch some other ones, you'll pay attention to the counselor's face, voice, and pace.
Absolutely.
Anything else? Okay. Those are the common mistakes. You can go to my webpage under handouts, and you can get a handout that will have this on, probably, I think it's on page 1, actually, of the handout.